we have some latest developments that you definitely don't want to miss. Let's start in India, where a heartbreaking update has come out of Andhra Pradesh. A 2-year-old girl from Palnadu district has tragically died after being infected with the H5N1 virus, more commonly known as bird flu. She was admitted to AIIMS hospital on March 4th with symptoms of high fever and difficulty breathing. And despite medical intervention, she passed away 12 days later. Now, what makes this case particularly concerning is that her family mentioned she had consumed a piece of raw chicken meat by mistake while food was being prepared, and shortly after, her symptoms began. Later, her tests report confirmed H5N1 positive, and the diagnosis was backed up by India's National Institute of Virology. Now, health officials are monitoring closely to prevent further spread. In fact, just last week, Cambodia reported a similar fatality in a 3.5-year-old boy. We are seeing the virus isn't just infecting poultry anymore. This pattern of child infections and associated fatality is raising red flags globally, especially as the virus continues to mutate. We don't know. Are we at the start of something? It's too early to say. But health authorities are now watching this one very carefully. And from one unsettling headline to another that stirred up quite a bit of speculation online. Mystery illness in Russia. Over in Russia, a wave of concern is sweeping through social media. Reports from independent sources and channels like SHOT are claiming people are falling ill with COVID-like symptoms. Extreme fatigue, persistent high fevers, and in some cases, patients are coughing up blood. Despite the chatter, Russian health officials are pushing back. They say there's no new virus, that what's being seen is likely Mycoplasma pneumonia, a bacterial infection that can feel like the flu. But here's the thing, some people are still skeptical, especially after past transparency issues during the COVID pandemic. So far, no restriction or emergency measures have been announced, but many patients are reporting symptoms lasting for weeks, and the official explanation hasn't fully put public fears to rest. Now, shifting from speculation to something a little more grounded, let's talk about COVID-19, because, well, it's still here. In Taiwan, seniors aged 65 and above will soon be eligible for a second JN1 vaccine dose, starting from April 1st. This move comes as emergency room visits for COVID rose nearly 5% last week. Not massive, but enough to prompt action from health officials. Meanwhile, in Macau, the situation's a bit more intense, where recent lab data shows that the COVID positive rate has jumped to over 40%, tripling since early March. The current dominant strains? Likely JN1 and some of its faster mutating cousins like XEC and LP8.1. Now, while the symptoms in most people remain mild to moderate, doctors are emphasizing that high-risk individuals, especially those who are immunocompromised, still face serious complications. So yes, even if the headlines have quieted down, the virus hasn't exactly clocked out. In fact, last month, we talked about the new variant LP8.1 and other circulating COVID-19 variants in our video. If you're interested, click the link in the I button or check the description for more details. And finally, let's talk about something straight out of sci-fi. And no surprise, it comes from Elon Musk. Neuralink has just announced it plans to implant its first vision-restoring chip in a human by the end of 2025. It's designed to help blind people see again. In early animal trials, the chip showed promising results. Listen what Elon Musk has to say.
So for Neuralink, we've actually had, Neuralink has had in monkeys a working device we call Blindsight, where it's been working well, and monkeys are healthy for a few years now. And we're hoping later this year to do our first device implant for a human, enabling someone who is completely blind to see. It's going to be low res at first, like Atari graphics, so I want to set expectations appropriately. So it'll start off with like very low res, but then over time, I think eventually the implant would enable vision that is like superhuman. So that'd be pretty cool. And then, yeah, things are currently on track to do unsupervised full self-driving in Austin in June.
Musk says it'll start with very low-resolution sight, but eventually his words it could enable superhuman vision. Think about that. We're talking about a brain chip that could help restore not just function, but enhance it. A leap that could redefine everything we know about sight, neuroplasticity, and accessibility. We're seeing just how fast global health is evolving and how interconnected they are. It's a reminder that public health isn't just about surviving a crisis. It's about staying ready for the next one, and being informed is step one. So if you found today's update helpful, give us a like, maybe share this video, and definitely hit that subscribe button for weekly health news that actually matters. Until next time, stay sharp, stay safe, and keep paying attention. The world is changing fast,